Well, good morning, good afternoon, good evening, everyone, and welcome to this first meeting of the new and restructured PMNCH board. The first time we've met in this slimmer structure, guided by the governance reform that's taken place within PMNCH. So we have an hour and a half of strategic dialogue today, focused on how we combine our strengths to advocate effectively for women, children, and adolescents. This board is seen as a board of champions. Under the new governance, the detailed operational discussions for PMNCH take place at the Executive Committee and not here. So we look to you, our board members, and your voices and those of your constituency organisations and networks to contribute to the global advocacy goals outlined in our 21 to 25 strategy and in the PMNCH COVID-19 Call to Action campaign. This board meeting now and going forward is seen as a platform to which we will also be inviting guest champions to support us, and where we can draw on each other to play our part in reaching collectively greater audiences than our individual contributions could. And we will later be sharing a social media post and card for those of you who post on social media in order to amplify the efforts of the Board of Champions. Today we'll be focusing on the necessary shifts in priorities for women's, children's and adolescents' health in light of the latest available evidence. And that includes that in the Rise, Respond and Recover action brief that was synthesised in the short background paper prepared for this meeting and shared with you. We can also draw on the report of the independent panel on pandemic preparedness and response, which was presented at the World Health Assembly in May, and which I was privileged to co-chair myself. And then there is the report of the Global Monitoring Board on pandemic preparedness, also as a resource. Considering this evidence, we can recommend shifts as and where required in PMNCH's approach to advocacy for country impact. We can also discuss how we as PMNCH can contribute to the global advocacy effort. We want today's conversation to be strategic in nature and concrete in outcomes. The Executive Committee meeting next week can then take forward operational details around the work plan and the results framework. So today's meeting, we are here at a time when COVID-19 continues to compromise the health of women, children and adolescents in many countries, where it magnifies the existing gaps between the haves and have-nots. We know that even before the pandemic, inequalities and inequities were widespread. While progress had been made in improving the under 5 and maternal mortality rates, more than 80% and 86% of deaths in those categories, respectively, were in sub-Saharan Africa and South Asia. The rate of stillbirths in 2019 was also 7 times higher in sub-Saharan Africa than it was in Europe. And within countries, we've seen those disparities existing on the basis of wealth, level of education, geography, ethnicity, and disability, among other factors. During the pandemic, women, children, and adolescents so often have experienced a drop in access to essential services, in particular to family planning and to immunisation. Therefore, the number of unwanted pregnancies has increased, as have associated morbidity and mortality. Women have been falling into poverty at greater rates than have men, as their livelihoods have been more severely impacted. COVID-19 then has exposed many of society's ills, entrenched in systems that see and support some but not others. But the pandemic has also spurred leaders, governments, civil society, and development partners around the world to seize the opportunity of this crisis to tackle pre-existing injustices and inequities in order to achieve greater health and well-being. As for PMNCH, its call to action on COVID-19 campaign is urging governments to protect and advance the health of women, children and adolescents in the context of their response to COVID-19. Working through its members, PMNCH can help mobilise political commitment to enhance financing and policies and service delivery for women, children and adolescents. Our campaign also supports in-country advocacy and accountability in support of these commitments. This is done through working with NGOs, youth-led organisations, communities, media and parliamentarians, among others. And we have with us today many of the partners who've made commitments and or contributed to their mobilisation. And we look forward to discussing how this approach can be strengthened and broadened to include others. So before we begin with contributions today, could I ask all the PMNCH board members and also specially invited guests and others who will be making interventions today, please turn on and keep your cameras on. And could others, including observers and advisors, turn off their cameras and microphones? That would be helpful. Thank you. We do have quite a full agenda with a number of contributions, so it will be important for everyone to be short and succinct. And please note, we are recording the meeting and we intend to make it available on the PMNCH website. So let us begin. We're going to be hearing from two good friends of PMNCH up front. The first is the Prime Minister of Barbados, Mia Mottley. And we asked her, tell us about the impact of COVID-19 in your country. And here's what she had to say. Play the video, please.
The COVID pandemic has disproportionately affected low-income countries and small island developing states. It has also affected middle-income countries in which 70% of the world's poor people live. And we therefore are confronted by the reality of inequities with respect to access to medical technologies, laboratory services, essential medicines, and vaccines. At a country level, there have been further disparities wherein the elderly, our women, our children, our adolescents are not necessarily receiving the same social protection and economic support to weather the ravages of the pandemic. It is essential that we create national, regional, and international strategies to support the most vulnerable among us so that no one is left behind. This, my friends, requires a whole-of-society approach that is enhanced by the contributions of civil society and NGOs, the private sector, religious and cultural groupings, everyone coming together with a single mission. Of particular concern to my country, Barbados, is access to vaccines and other therapeutic agents, which are skewed away from the economically disenfranchised, and which even for those of us who are middle-income countries, we have been denied access by the use of crude proxies, such as whether we have certain levels of maternal mortality, nothing at all to do with the reality of the risk to COVID. We therefore face a double burden, wherein there is less access to countries such as ours, who in turn have specific vulnerable populations with specific needs. Countries need to set aside a number of resources for their vulnerable groups and key populations, and we want to do so, but we have to have not just access to concessional funding, but we equally have to have access to the fiscal space even when the funding is available. These are not normal times, and therefore, as we seek to develop tailored social interventions that reach people in communities where they live, we need to have the resources, because without life we have nothing, and therefore our primary responsibility is to keep people's heads above water.
Well, powerful words from Mia Mottley. You know, without life we have nothing. So true. And also let us note her call on the vaccines. We're aware from the information continually put in front of the world by Dr. Tedros and his team at WHO, just how inequitable the rollout has been. It has to reach everyone if we are to stop the pandemic and prevent the further compromising the health of the world's most vulnerable, who include many of those for whom we advocate. So we're now going to come to the message from the President of Estonia, Kersti Kaljulaid. Kersti has recently been appointed by Antonio Guterres as his global advocate for every woman, every child. And Kersti, in her video, discusses what she perceives as key priorities to be tackled in the coming years and how she's going to use her voice to make a difference. She is a wonderful champion on whom PMNCH will be able to draw. Please run Kersti's video.
I'm truly honored by the invitation from the Partnership for Maternal, Newborn and Child Health to greet you at the very beginning of sort of a new area for you too. I know that this is the first board meeting for you, following an extensive governance reform. And I wish the board with its new mandate to succeed in uniting and energizing partners and efforts all over the world. We all sincerely hope that this new board will help in a way to fill the void left by the Every Woman, Every Child high-level steering group and really raise global awareness and advocate for issues regarding the health and well-being of our most vulnerable. As the global advocate for women and children, my focus will be on 3 key areas. First, I want to work on making sure that we will not lose the success gained in the previous decade in decreasing the maternal mortality rate. And I want to help make sure that the future success could also be distributed across the world more equally. I want more countries to be able and motivated to provide safe and accessible services, both medical and humanitarian, and education for every girl and every woman. I also believe that working together with World Health Organization to understand better individual risks and problems for maternal mortality in individual countries, we could have more and better understanding where and how to work on these issues. Because even if the numbers and the sad statistics may seem the same, the real reasons behind the high rates of maternal mortality might hugely differ. A better, well-organized, easily accessible and shared information will help to guide our NGOs and our resources where we have low-hanging fruits, and also to guide us to work with specific bottlenecks wherever they are. Second, we all know that we are not on track to achieve zero hunger by 2030. We were not there before the pandemic, and due to the pandemic, we are not getting any closer. I'll try to follow closely the situation of children, adolescents, women, especially mothers. We need to make sure that whatever the situation in the world or a specific region, clean and safe food, rich in vitamins and minerals, reaches the most vulnerable. Indeed, this means working with all partners globally and finding the most suitable ways, again, for every country under whichever regime, governmental, non-governmental regime, we find starving children, to work with them best. I thank all the partners who take huge risks daily to go and help starving kids, wherever they are, in conflict zone, under the regimes which we don't even want to think about ourselves. They are there, they are not judging, they're helping. Thank you all. Third, as an Estonian, I want to put on the table what we are here in Estonia the best at: digital tools and innovation to transform societies. The pandemic, of course, has highlighted the importance and possibilities of technology. And now we understand much better that some simple and easily accessible technologies, like mobile phones, for example, can be used to cause really important societal shifts. For example, many people in developing countries bank online via their mobile phones. Why not to try and achieve something very important for societies, also using mobile phones? My objective is to create an easy system by which each and every woman who has given birth can safely, from the handheld mobile phone, to register the birth of their child wherever they are and in whichever social status they find themselves. If we do not know who is born to whom and where, how on earth can we help them? How on earth can we measure the effectiveness of what we are doing for these children? Most governments nowadays accept that to help their citizens, they need to know who they are. And I'm quite sure that we can create and generate a global understanding that easily accessible birth registries give a much better basis for all states globally to provide for and help their citizens. It will also give you ready-made electoral lists, which I hope will harmonize my objective with the objectives of many governments. It will also help us to later on share this data, if we are willing to share this data, to see and help those children who might be victims of child trafficking. Everything starts with not having anonymously born, anonymously suffering, and anonymously dying children globally. Be it a report I could help to highlight, an opinion piece I could write, a key event I should be at. If you feel that we could be of any use to each other for your organization's goals and to mine as the global advocate, let me know, and we will certainly find a way to make it work. Just before recording this video, I also had a bilateral video call with Helen Clark, and we harmonized our thinking on how I could fulfill my role and serve your organization as well. Thank you all, and may you have a very fruitful board meeting. Looking forward to hear from you again.
Well, we're very appreciative that President Kirsty took the time to record that very warm message to us, and I think her messages will have resonated with many, particularly the birth registration, I think with UNICEF, which has had a major campaign for years to support the registration of every child's birth, and you now have a new powerful advocate. Now, we want to hear from the board vice chairs. We have vice chairs held by the India and the United Kingdom. It's the way of the world at the moment that many governments have emergency meetings. So the two people who sit in the chair have been called away to emergency government meetings. But of course, they have sent their representative to say what they would have said could they have joined us. So I'm going to call first and hope he is there available, Ashok Babu, who is the Joint Secretary of Health and Family Welfare from the Government of India. India speaks from the perspective of a government which has committed to the call to action on COVID-19 and can speak on how commitments can help advance government action on women, children and adolescent health, and how PMNCH can strengthen its support to countries to make and implement commitments. So, Ashok, are you there? And if you are, you have the floor. Please, Ashok.
Namaste from India to all. Thanks very much, Helen. Today I am here representing Mr. Rajesh Bhushan, Secretary, Ministry of Health and Family Welfare, India. The joining of a new minister, Honorable Minister, today, and an important cabinet topic on health that is coming at this moment. That's why both Mr. Bhushan and Mrs. Vandana Gurnani could not attend this. So I am representing them. I echo Helen's welcome to this reinaugurated and sharper board. It gives me a sense of satisfaction to see this level of representation. Your presence here today is a sign that this board will put its collective strength behind this cause, and voices of women, children and adolescents will be heard with greater compassion, and their health and well-being needs and demands will be addressed. The last year and a half has been a tumultuous and turbulent journey of immense loss, but also one of that reinforces the message of solidarity, that together we can do more and do much better than we can alone. A message which is very much the DNA of PMNCH. Helen painted an alarming but not surprising picture of increasing inequities. The pandemic has created another pandemic for those who are already marginalized and vulnerable. Almost all countries, whichever development bracket they may be in, have suffered, children, adolescents, and young people have been pushed to periphery and have lost critical years in their development trajectory. The gendered impacts of pandemic are known to all, and PMNCH has rightfully played its part in rallying behind this population by leading on call to action, and we, as India, remain committed to this. India continues to implement a whole of government approach as the bedrock of our COVID-19 response. Multi-stakeholder and multi-sectoral partnerships are essential levers for delivering on our commitments. For instance, India is harnessing the power of young people through an interministerial youth-led campaign to reach out 50 million families with COVID-19 and vaccination-related information. The centrality of communities and community health workers remain undisputed, and experiences from countries like Liberia and India have attested their role as the most critical first responders in the COVID-19 crisis. The need to invest in them as well as in human resources for health has never been greater. The overburdened and overstressed health systems and workers continue to deliver services despite deep personal losses. Greater investment is needed in their capacity building, task shifting, better pays, incentives, and social security. Primary healthcare has been a central tenet to universal health coverage, and this pandemic has proved its importance once again, not only as first point of contact, but also as a lifeline for delivering essential services, especially for women, children, and adolescents. Leveraging digital technology, supporting innovations, and strengthening local capacities to develop solutions for the problems have also emerged as priorities and will be key to future preparedness and resilient health systems. Rollout of effective vaccines has brought much needed relief, but issue of equity and accessibility will still need to be addressed. The sooner we address these, the closer we are to being safe. No one is safe until everyone is safe. There is an acute need to move beyond discussions on intellectual property barriers for all COVID-19 related interventions and institutionalized systems for technology transfer, supply of raw materials, funding and assistance to countries to overcome the bottlenecks. PMNCH, through its champions and wide network of partners, both at the grassroots and grassroots, can be instrumental in shaping this discourse. Relevance of partnership like PMNCH is even greater in the post-COVID-19 world, where we are trying to build local systems and capacities, but at the same time, countries need enhanced global cooperation for sharing of global goods and good practices, supplemented with ring-fenced funding to protect the progress made on health and well-being of women, children, and adolescents. I urge all of you to use your powerful voices to pitch for the health and rights of women, children, and adolescents in your countries, communities, and networks, and lend support to PMNCH call to action on COVID-19 and its 7 R's, committing resources, targeting gaps, and enhancing equity, and to actually walk to the talk on not leaving anyone behind. At this juncture, I convey my deep apologies from Secretary Sir and Vandana Madam for their inability to attend the meeting. Thank you, and back to you, Helen.
Thank you so much, Ashok, and thank you for the ongoing strong support of the Government of India for PMNCH. It is much appreciated. Now, our Vice Chair and Executive Committee Chair, Darren Welsh, has managed to rush back to get to our meeting. So, Darren, I'd like to call you in, as you really are leading that work on the Executive Committee to ensure that we become as effective as we can be. So the floor is yours, Darren.
Thank you very much, Helen, and good morning from London to everybody, whatever time it is where you are. It's so nice to see everybody on the screen today and to hear from our Indian colleague as well. And we all, of course, continue to express our strong solidarity with the government of India at this time. I want to say a few words about the G7, actually, Helen, and the kind of the context for global health at the moment and the opportunity that I think that gives us, because the UK presidency of the G7 has put a really sharp focus on health right across the Foreign and Development Ministers meeting. I was in that health discussion, and I can tell you there was a real sense of coming together and of determination to step up and do things differently. Obviously, the health ministers discussed in depth how we're going to respond to and recover from C-19. And finance ministers are going to be looking at this, have already, but are coming back to the issue because the financing piece for future global preparedness is so important. And leaders, of course, at Carbis Bay adopted the health declaration. And one of the important things about the G7 was it was inclusive this year. We had our colleagues from the government of India join. We had South Korea in some of the sessions, and also South Africa. So there was this sort of reaching out. And you can have a debate about whether the G7 went far enough in every area. And there has been a lively debate about that. That's reasonable. But I think what they've done is created some entry points and opportunities and openings for us. There was particularly discussion around equitable access for vaccines, and I think we all recognise that we are still some way from achieving that, as Mia Motley has powerfully reminded us. But nonetheless, some big commitments there to lead an effort to vaccinate at least 60% of the world by the end of next year, and to bring the pandemic under control, and donating 1 billion doses of vaccines. So there's a lot of focus on equitable access, but a much broader discussion as well about future preparedness. And within those, the various documents that were published and the discussions that were had, there was a lot of reference to the needs of women, girls, adolescents. I think that's a powerful opportunity for us there. There was talk about ensuring fairness, inclusion and equity, and empowering the leadership of women and minorities in the health and care sectors. There was talk in the communique about achieving universal access to quality and affordable, comprehensive sexual and reproductive health services as a means, or as a step towards achieving a universal health coverage. And there was commitment to mitigate the widespread disruption to life-saving essential health services, including the safe delivery and for family planning. And the G7 Foreign and Development Ministers also endorsed a Girls' Education Declaration, which set out a plan to work in collaboration with the global community to tackle barriers to girls' education. And for the first time, this included a commitment to increasing access to comprehensive sexuality education, representing the many of the barriers to girls' education are in fact related to access to SRHR services. And it's quite a contested area, so really good to see the G7 take a stand on that. But I think my message is that we've got a big opportunity as PMNCH to engage in holding those G7 governments and the organisations they fund to account, looking at all of those health commitments with a women's, children's and adolescents lens, and to take inspiration, in fact, from those commitments for our wider advocacy work in partner countries. And I think we're in great shape. Following the governance reform that we've put in place and having such strong champions and such a powerful board, I think we're really well placed. So my call on us is to use the momentum and the profile the G7's given to important health issues, and to drive forward our advocacy work under our new structures and the new team we've got in place as we rise, respond, recover. Thank you.
Thank you so much, Darren, and thank you for the leadership you're giving the Executive Committee, and certainly under the United Kingdom's chair of G7. We've seen global health on its agenda like never before, I think. Mind you, we are in a crisis like never before with global health, but the opportunity has not been missed to highlight it. So thank you so much. And you mentioned champions. I should add that both Mia Motley, Prime Minister of Barbados, and Kirsty Calgelade have agreed to be champions for PMNCH as well, formally. So that's very helpful. So coming now to strategic dialogue session and wanting to hear from board members about what you think PMNCH should be focusing on at this specific time, the activities, the ways in which we do our championing of the health of women, children, and adolescents, and with partners. Obviously, not a lot of time is allocated for the board meeting, 2 hours in total, so we might not get right round the table unless people limit their speaking times to that maximum 2 minutes or so. And I would encourage people to use the chat box function to share contributions with regard to action points and priorities. And I'll be asking the Secretariat to keep a close note on those. But let me begin now with asking board member, the Minister of Health of Liberia, Wilhelmina Jala, to speak on her experience in managing COVID-19 in her country, the impact it's had on those we work for in Liberia, and about the impact she sees the call to action having had. Wilhelmina, can you come in, please?
Good morning to all, and good morning from Liberia. Madam Chair, Madam Vice Chair, distinguished member of this board. Let me first thank you for allowing me to be a part of this distinguished board. And I hope I will do service to the people of not only of Liberia, but the rest of the countries that are involved. Now, over the last months, since last year, 2020 of March, when we saw our first case, Liberia has been taking lessons from our past experience from the Ebola. Once we saw our neighboring countries were recording cases, we started developing action plans and guidelines. We began engaging the communities to go back to all of the preventive measures. We employ a multi-sectorial approach in developing a national COVID-19 containment plan. We started doing testing at the airports, and we started quarantining those who were coming to Liberia during that time. Like our colleagues from India, the government of Liberia focused to ensure that routine services continue. We instituted a revolving team to provide support to PHC facilities and also to establish reproductive health units at the COVID-19 treatment center to ensure that services to women, children, adolescents continue uninterrupted. Now, the impact of COVID on Liberia during the first wave, because we had first wave, second wave, and now we are experiencing the third wave. During the first wave, we saw immediate decline in the utilization of our PMNCH services. Pregnant women were refusing services at health facilities, and most were afraid to seek care. We noticed a slight decline in facilitated delivery by 8% and a increase in community delivery. ANC 4 decreased by 18%, while PMC decreased by 14%. There was by 40%. Due to the lockdown, it became difficult for adolescents to have access to family planning and other services. We also saw an increase in the reporting of rape cases. Of course, health workers' fear of contracting the disease, as well as the community fear from the health facility, led to a decrease to services utilization. The economy declined as the situation intensified. Impact on economic have been immense. Families and homes have been destroyed. Children and young people have lost time. Peer-to-peer contact were also declining, and there was the mental health issues and nutritional status also declined. Considering Liberia's commitment to PMNCH and call to action, Liberia remains committed to this action. That has been taken up as the highest level. The president has declared sexual gender-based violence as a national emergency, and a national task force has been established to address the situation. Further action continues to be taken, including establishing and optimizing one-stop center around the country. We will continue to prioritize WCA in our recovery efforts, making sure that domestic resources committed to WCA do not change. We need support from global partners to orchestrate a concrete response, but this support needs to be in the context specific. We need partners to address gaps that we cannot address, especially on the line of vaccines, where we need to vaccinate more of the population, especially women and people over the age of 18, to make sure that we reach herd immunity in Liberia. Before I close, let me say that in Liberia, we have worked with all of the traditional partners, but have missed working closely with private sector. The efficiency of private sector and the emphasis in areas like program management, moving vaccines, SRH services, and commodities will be very useful. Mobilizing private philanthropists' contribution to the national program will be very. We are optimistic that with PMNCH advocacy effort, we will be able to bring more partners together to support our national efforts and at a minimum guarantee a basic package for all essential services to women, children, and adolescents. I thank you.
Thank you so much, Minister, for that very valuable set of insights into the impact in your country and your call for partnerships. Very important. I'm going to come now to the Director of Global Health and Development in the French government, Agnes Soussard, and ask Agnes to address how useful she thinks PMNCH can be in accelerating the COVID call for action for universal health coverage and delivery for women, children, adolescent health, and to speak a little about what France is doing. Agnes, you have the floor. I can return to Agnes, but I think perhaps we could now come to play the video which we have from Petra de Sutter, the Deputy Prime Minister of Belgium. I've just spoken to Petra tonight. She has a lifetime background of commitment to sexual and reproductive health issues. And we asked her how partners and governments can improve sexual and reproductive health and rights, and how we can support women and girls to recover from these spillover impacts of the pandemic. So can we play Petra's very short video now, please, technical team? Thank you.
Dear members of the board, thank you for this very important question. As a gynecologist, SRHR, sexual reproductive health and rights, have always been very high on my political agenda. Consequently, defending them has been a key priority in my political work in the Belgian Senate, Parliamentary Assembly of the Council of Europe, and then the European Parliament, and finally now in the Belgian federal government. Over the past years, I witnessed how a growing international backlash has weakened political and financial support. Also in Europe, we have been confronted with a more hostile environment, which shows us that none of our more progressive rights and liberties are acquired forever. In COVID-19 times, inequalities have further increased. The pandemic has resulted in critical declines in sexual and reproductive health services, and it has exacerbated already existing inequalities for women and girls, adolescents, and groups who were already marginalized and discriminated. What worries me even more is that some governments have been misusing the crisis situation to further undermine SRHR and women's rights. Some European countries have been taking steps during the pandemic to tighten their abortion and sexual education laws or introduce discriminative anti-LGBTQI laws. These debates do not come out of nowhere. This pushback is often orchestrated by ultra-conservative European and global networks who manage to infiltrate institutions and governments. So if you ask me how to build back better after COVID-19, I would say we should continue our fight for human rights. But we should also counter those that are opposing human rights. We cannot let the ever-growing influence of anti-human rights organizations and politicians stand in our way. To build access to comprehensive and inclusive sexual and reproductive health and rights now and in the future, there is a clear and pressing need for political commitment by leaders and champions at every level. And to do that, all human rights activists working on different themes, but also academics and politicians need to join forces, because SRHR, women's rights, are essentially the same. They're human rights, and we have to defend these human rights with rigor, stand up for them and promote them in our own countries, in Europe and beyond. We have to make clear that we refuse a lockdown for human rights.
Well, that is a great line. We refuse a lockdown for human rights. And thank you to Petra for putting it in that context. I'm wondering if Agnes is in a position to come back in at this point. Yes, please.
Yes, thank you very much. I'm sorry, I had a connection problem. Thank you for inviting me to join and provide some remarks. And I really want to emphasize how important this partnership is when it comes to join hands on the objective of universal health coverage. And in today's world, and at this particular time where collective action is so important, it is so important that our communities unite with the objective of the commons, and that we together help countries organize societal dialogues that are very inclusive, very participatory, so that they collectively ask their leadership and their governments to actually deliver on those commons, on these common goods, which includes the response to COVID, but also the investments in what we call the step 0 of universal health coverage, which is the investment in public health functions in those common goods for health, which include surveillance, laboratories, but also investments in communication and legislation and regulation and policy that need to be oriented towards the well-being of people and include the voice of women and children. So that's really a most important time to be united and to focus on the commons. I also want to emphasize the particular contribution of France to this agenda, and particularly at the occasion of the Forum of Generation Equality. And France has really a very strong commitment, as you know, to the equality of men and women and the gender agenda. And we've announced an additional 100 million euros for a rights-based approach to sexual and reproductive health, as well as the 333 million euros for the Global Partnership for Education, because we recognize that education is at the center, particularly education of girls is at the center of what is needed to reach this equality. And in this 100 million euros additional, there is really a commitment to family planning and to reproductive health rights through 90 million euros to UNFPA, but also a renewed commitment to sexual and reproductive health through our French Development Agency, my agency, for 250 million over the next 5 years, 50 million per year, and the renewal of the Muskoka initiative for 10 million per year, 10 million euros for the next 5 years. So very strong commitment. Really, the French support to this agenda has really two legs. On one hand, the support to health system with the step 0, which is the support to the common goods for health, support to those public health function, and the second leg, which is the very strong emphasis on gender, on equality, and investment in women, and particularly the investments in maternal health and reproductive health. So thank you very much.
Thank you so much, Agnes, and thank you for France's commitments. The Generation Equality Forum had a very good action commitment stream on bodily autonomy and sexual and reproductive health and rights, which I was privileged to chair, and indeed there were some great commitments expressed there. I want to come now to private sector input into our discussions, and that will be from Birger Brenda, who is the president of the World Economic Forum based in Geneva. Birger, could you please share your thoughts on how you see the private sector best being able to be engaged in this work for mitigating impacts of the pandemic on women, children, adolescents, and the role that you would see PMNCH as playing in this? So can Birger Brenda come in? I saw him connected earlier, so I'm hoping that he's still there.
Helen, I've just got a message and saying that they're not able to unmute him.
Okay, can you work on that technically?
Yes.
And I'm going to come back when it's resolved.
Yeah.
So I'm going to move right along to David Embargo from the Adolescent and Youth constituency of PMNCH, and ask David to reflect on the role of youth in improving health outcomes and how youth efforts can best be supported. David, are you able to come in, please?
Yeah, thank you so much, Helen, for giving me the opportunity to reflect on this issue. Based on my experience, most youth leaders start working on social change for personal motivations. Most youth leaders start volunteers in different organizations, and they are eager to cause a positive impact in the communities. This passion for a better future is a unique opportunity for experienced organizations or experienced individuals to build capacity for these young, motivated current and future leaders. I can share quickly my personal story. As a young medical student, I became involved in SRHR after coming out as gay, for example, and seeing the importance of a rights-based approach to healthcare. And I found organizations that were willing to support my capacity building in these topics. For example, PMNCH itself, the IFMSA or IPAS, just to name a few. Capacity building for youth leaders and youth networks at the country level is a strategy for addressing the unseen impact of the COVID-19 on these population groups. Capacity building can lead to a cohesive youth voice and coalition building that PMNCH has done successfully over the past few years through youth grants, for example. Through the AYC, we have a powerful platform come to life at the global level, providing a safe space for us to raise issues and also be part of the solution. COVID-19 has raised the importance of digital technologies, not to only provide health services, but also access education, for example, being in contact with friends and family, and many more. Digital technologies are often associated with young people since we are considered digital natives. However, youth's potential to use digital technologies for improving health outcomes is obstructed by the inequalities that youth face to access internet services, smartphones, laptops, etc. Unfortunately, the gap still exists, and this means that in terms of accessing health services in person or traditional services must still be in place. This private sector has an immense opportunity to close this gap. Now, how can youth be best supported? I have said this several times, and I will continue to say this as many more as needed, but provide adequate funding to youth-led and youth-serving initiatives. This includes allocating the appropriate amount and trained human resources proportionately to the size of the projected intervention. As an immediate next step of this board meeting, I request members and guests to endorse and support the call to action for adolescents, which is the first of its kind, calling for a UN summit on adolescents. The last time the UN passed a resolution on adolescence, it was in 2012, and many things have happened in the last almost 10 years related to adolescents' health and well-being. there is clearly a need for a focused attention on this 1.2 billion strong population group. And I would like finally to just say that I would like to ask everyone to kindly amplify our efforts and mobilize your networks to support us. Thank you very much, Helen.
Thank you very much, David, for setting out clearly, as you always do, what the ask of the adolescent and youth constituency is. Thank you so much. Let's come to Franca Cardi, board member and president of the International Confederation of Midwives, obviously one of the sectors, professions in the health workforce which has been on the front line during the pandemic. Franca, ask number 4 in PMNCH's call to action focuses on strengthening human resources for health. And that's been at the heart of our advocacy over all these months of the last year and more. So could you share your views on priority actions for the health workforce, which PMNCH should be supporting?
Great, thank you so much, Helen, and thank you everyone for the speakers. Really wonderful comments, and it's great to be here today in this new format. My comments actually relate to nearly all the 7 asks, but of course especially 4, as you asked, Helen. And 4 is mainly about investing in healthcare professionals and especially in midwives and nurses. And I have 3 main points that I think will contribute to building back, first of all, fairer and therefore better. So for universal health coverage, we need 18 million more healthcare personnel, but we especially need midwives and nurses. And midwives and nurses are predominantly women, and we constitute 70% of the workforce. We really need to get these figures in our heads. It's so important for us to realize this. Then the second point is about gender and power dynamics within the healthcare professional institutions, because this is seriously hindering our progress and needs to be addressed urgently and openly. And of course, that research shows that universal coverage of midwives, it has the potential to avert 4.3 million lives yearly by 2035. And so to point 1 about more healthcare workers, so we need 18 million more to achieve health coverage, mainly midwives and nurses. And according to the State of the World Midwifery Report, the world needs about 900,000 more midwives to achieve universal coverage of midwives. Then to point 2, the gender dynamics and the power dynamics. The power and these dynamics between healthcare professionals are really problematic. For midwives and nurses, the gender pay gap is 25%, but often they don't even consider this because they are really confronted daily with intimidation. And as ICM, we're getting signals that this problem is getting worse. It's being exacerbated, and we feel that possibly the COVID pandemic has something to do with it. We're getting very many signs from nurses and from midwives, but mainly the women's health workforce, that this issue really is being exacerbated. I'm really thrilled to share that the Healthcare Professional Association constituency is going to be supported to address systemic biases with the great support from Helen and Darren. So thank you for supporting us on that. And we really hope that we can set an example to the global community on how we want to move forward and how we want to work with each other so that we can have progress, because it's hindering progress at the moment. And then the third point about the key role of midwives. I really believe that if midwives were a pill, we would be administered globally. So according to a paper on the impact of midwives in the Lancet last year, universal coverage of midwives in 2035 could avert 4.3 million lives. That's universal coverage. Even a 10% increase of midwives could save 1.3 million lives yearly. And at our global ICM conference, which we had last month, which was the biggest gathering of midwives ever virtually, we really came to the conclusion that we need to start doing midwifery instead of talking midwifery. Really, the time has come. And so as ICM, we are growing. We are with a growing number of partners. We've set up a new 10-year campaign to 2030, and it's called the Push campaign. And in this Push campaign, we are going to push for change. We are going to push for more midwives. We are going to push for respect. And we really look forward to joining hands with our PMNCH partners to push for change. And that is all. Thank you so much, Helen. I think I kept to my 2 minutes there, didn't I?
You did very well, thank you. And I'm now off mute. And thank you for reminding us of this huge challenge of the need for the 18 million more workers in the health workforce within, I think it's by 2030, am I right? And I think this problem is now exacerbated by the pandemic. I know in the consultations we did for the independent panel, we were getting feedback from midwives and nurses of more attrition in the profession because of the pressures that people had come under. So very, very challenging issues. I think we have Brenda online now and have overcome the technical challenges. So please come in, Berger.
Well, thank you, Helen. I hope you can hear me now.
Very clear.
Oh, thank you. I was there, but I was muted and we were not able to unmute. I think this has become one of the most common challenges these days. So hopefully we will move into also a period where we can also meet physically. But as you mentioned, I don't think we're out of the woods yet. The World Economic Forum, being the international organization for public-private cooperation, we very much believe that shaping this recovery, I think also private sector will have to take a major role. It is a fact that $15 trillion have now been used in unparalleled stimulus. Unfortunately, only 1% of this have been used in developing countries. And with less fiscal muscles in the years to come, I think we also have to mobilize private sector to fulfill also what we expect when it comes to sustainable development goals, and not at least in this context for women and girls and adolescents' health. And I'm positive that we cannot reach the SDGs without also fulfilling all the aspirations we have in the health area. We know that if a girl is sick, she cannot go to school. If there is no clean water, the waterborne diseases, it will also have extremely negative impact on all the other issues. Where we have learned during this pandemic is that the private sector can also be a very powerful partner with governments. We would not have seen vaccines against COVID being developed in less than a year. Usually it takes 8 to 10 years without also having been able to mobilize the pharmaceutical industry. And I think we can learn from this, and here the World Economic Forum is also someone that you can rely on, Helen, and also Helga, one of my big inspirations in this area, also from my previous life. I think you can count on us also mobilizing the private sector to play a very constructive role when it comes to women and girls' health, because this is crucial and it is the right thing to do. And where we can start is making sure that more than 1 to 2% of the vaccines are now available in Africa. It is not acceptable what we're seeing now on the global vaccination distribution. And of course, girls and women are also here, even faring worse than men. So thank you for inviting me.
Thank you, Berger, and we really appreciate you coming on board. The World Economic Forum is a very powerful platform, and your advocacy means a lot to us. So thank you so much for taking the time to be with us. Moving right along, coming to Aminu Magashi-Gaba, a leader of the Africa Health Budget Network, who's played a key role in mobilizing civil society, including media, to support the government of Nigeria's commitment to the call for action on COVID-19 issued by PMNCH. So Aminu, please come in and tell us how you think PMNCH can better serve governments and communities in improving the health of women, children and adolescents. Aminu, calling you in. Are you there?
Thank you, Helen. Yes, I'm here. Thank you very much. Hope you can hear me well.
Hear you well, thank you.
Okay, so thank you very much for this opportunity to share in 2 minutes the Nigerian experience and what the role of the partnership will continue to be doing in supporting and catalyzing, civil society, media, young people at country level to engage meaningfully with the government. So let me first and foremost mention that the convergence at the country level of all the different categories of the partnership is at the country multi-stakeholder partnership coordination platform. So this is the convergence, for all of us in Nigeria. The Nigerian government, through the call to action of the PMNCH, have strengthened the country multi-stakeholder platform to ensure that all the non-state actors, civil society, media, young people, including parliamentarians and the Ministry of Finance and Ministry of Water Resources, are playing a critical role in facilitating and coordinating a government response to the RMCH+N problems in Nigeria. I'm happy to note that before the Minister of Health in Nigeria, Dr. Osagi Ehenare, made the commitment on behalf of Nigeria government, we in the AHBN and the civil society and young people convened a meeting in October, November last year and presented the call to action to the government officials and amplified the value of coming together to ensure a government response to the call to action. And in December, the minister spoke eloquently at the summit of the PMNCH and core group and presented the commitment. From that December to April and May, before the summit, we convened series of meetings in Nigeria. We trained the media to celebrate the World Health Day, as well as participate in the Nigeria launching of the 2-year operational plan for a government response and a recovery for the COVID-19 in the area of RMCH+N. And we have recorded over 40 media publications in Nigeria, courtesy of civil society mobilization and coordination with the media and the young people. We also supported the government to convene the second quarter of the multi-stakeholder platform meeting. And for the first time, the Ministry of Water Resources, Ministry of Finance, parliamentarian, all pledged to be part of this process of coordination. So in summary, we have begun to see a lot of remarkable and commendable changes at country level of the value of the partnership, harnessing the power of everybody at the table to promote the common agenda. So we'd like to thank the PMNCH for providing a small grant to AHBN to support this convening in Nigeria, and we look forward to more partnership. And most importantly, before I wrap up, is we are also calling on the partnership to continue the coordinating and the convening and facilitating role at country level. That is very key to bring finance, health, parliamentarians, civil society, young people at the table to continue the dialogue, the power of the harnessing the partnership. So this is one appeal we're making, that this role of coordination by the PMNCH and all the partners today in the board meeting to continue to support Nigeria, Liberia, Sierra Leone, Kenya, Afghanistan, and all the countries from the southern part to continue to play this role, bringing the country level experience to the global level. So thank you very much, Helen, for this opportunity to speak. We look forward to continue the conversation.
Thank you.
Thank you and over. Thank you.
Thank you, Aminu, and thank you for keeping it real and telling us how you're operating on the ground in Nigeria and on the continent through the network. Just to note in the chat box, there's good links going up on the State of Midwifery World Report, the call to action for adolescents, and also from ICM's push campaign around midwifery. And I'll ask those who want to take the floor, please use the raise hand function. I'm going to call Martin now, and then I see Anuradha has her hand up next. But Martin Chungong of the Interparliamentary Union, a wonderful champion of PMNCH. IPU has also been engaged in mobilising commitments and in supporting budgets, legislation, and policy which are women, child, and adolescent health friendly. Martin, how can PMNCH support you and your constituency in this important work?
Thank you very much, Helen. I am very pleased and excited at the prospect of continuing to serve on this re-energized board, which is going to be doing great work in the context of a new revised strategy for PMNCH. And you said in your introductory remarks, Helen, that we needed a strong political commitment. We needed to be robust in our advocacy work to ensure accountability for women, children, and adolescent health. And I think that PMNCH and the IPO already have a track record of working together to foster that political commitment and political will. I see this as an ongoing priority with PMNCH, especially so as we already have a policy framework within the IPU that allows us to place women, children's, and adolescent health firmly on the political agenda. You will remember that in 2019, we did insist on including specific reference to women, children, and adolescent health, the sexual and reproductive health and rights in the IPU Global Universal Coverage Resolution. And I think that that should continue to serve as the guiding policy document for what we are doing. I think that I am committed to pursuing our advocacy work, reaching out to the highest rungs of the parliamentary ladder, the speakers of parliaments, to ensure that they are on board with us when it comes to the PMNCH call to action. We have already done this outreach, but we should continue because we are seeing some results. For instance, the Paraguay Parliament actually adopted a formal declaration urging the government to sign up to and implement the PMNCH call to action. So we need to multiply these examples of good practice across the world. Over and above that, I also think that we should also be looking at how we help implementation of the call to action at the national level, working with the parliaments, making sure that parliaments in the key priority countries can forge alliances with other stakeholders, including civil society, the young people, as one of my the colleagues said earlier in this discussion, so that we can begin to create a critical mass of good, I would say, political will at the national level to move the PMNCH agenda forward. So I thought I should mention this, and also I think we should be paying particular attention to marginalized groups within the vulnerable groups already that we are dealing with. And the last point I want to make here is that we should also be, each and every one of us is a champion, and we do have our own networks where we are very active. Earlier this week, I met with the UN Secretary General Special Representative on on conflict-related sexual violence. I think that she has a contribution that she could make to our collective agenda. And I have signed an agreement with her to promote parliamentary action in stemming sexual violence and armed conflict. I think that we should be looking at how we can weave some of our own agenda priorities here into the work that we will be doing with her. So I wanted to put this on the table for discussion so that we can explore opportunities for collaboration with the Special Representative of the Secretary General. Thank you very much, Helen. I hope I've made some sense of how I see our work forward in fostering political commitment, advocacy and accountability, and practical implementation, especially for marginalized groups. Thank you.
Thank you so much, Martin. And of course, IPU, I think, has membership of every national parliament in the world. So you have parliamentarians worldwide able to exhort governments to act. And that's very, very powerful indeed. Now, coming to hands raised, I'll start with Anuradha. And I'll ask those commenting really to focus on what you see as a priority for PMNCH for the next 6 months until we meet again, and how you see your own organisation / constituency network contributing to that. And I'll continue to look for comments in the chat box as well. Anuradha, please come in, and you'll be followed by Abu Bakr of UNICEF.
So thank you, Helen. And I would just make 2 quick points. The first is that we've heard all speakers emphasize how the pandemic has deepened pre-existing health inequities and how important it is to focus now on marginalized, vulnerable population more than ever before. And in that context, I would strongly recommend that PMNCH focuses very sharply on bringing equity front and center of all its advocacy efforts. And why I am stressing this point is that when we embarked on the new strategy for PMNCH, and I was a part of that group, we did emphasize equity at that time, recognizing that progress on maternal and child mortality had begun to stall, actually slow down in most of lower income countries, because the services were not reaching those populations that deserved them the most, and also where disproportionate burden of mortality and morbidity was concentrated. But I think this has become even more important now in the wake of what the pandemic has done to push these populations further to the brink. Now, when we look at the immunization space, we have been saying that there are about 10% children who do not receive even a single vaccine shot. And we have termed them as zero-dose children. I have spoken about them in the past. And we have gone on to demonstrate, based on very powerful evidence, how these zero-dose children are markers of those communities that suffer not just from lack of immunization, but other services, and more particularly RMNCH services. So 2/3 of women in these communities are likely not to have access to skilled birth attendance and antenatal care, contraception, and most of these communities do not have access to water and sanitation. And you can imagine, they live in cramped spaces, they can hardly do physical distancing, in COVID age, and therefore really require the protection of not just COVID-19 vaccines, but other essential services. We are very heartened by the fact that the SDG 3 Global Action Plan that has just been released, its report has been released, and that has recognized the concept of zero-dose children, and the fact that zero-dose children actually represent communities facing multiple deprivations, and therefore focus on zero-dose children would be a core strategy in its efforts to have resilient recovery from COVID-19. So I just do want to encourage PMNCH to embrace this concept and make sure that we focus on that a lot, because that's where we are putting a lot of our investments. And I'm sure Abubkar and WHO might want to speak to that, because we are working in tandem with GFF, Global Fund, WHO, UNICEF, and other partners. And as a part of this collaboration, we are also wanting to put some modest investment in PMNCH so that we can bring several other partners along this journey, because without addressing inequities, we definitely cannot hope to bend the curve on maternal and child mortality. The second point that I want to make is about COVID-19 vaccines. And a lot has already been said about lack of equity that we see. Of course, that's an important agenda. You know, Gavi is co-leading COVAX. We're working towards that. And our projections suggest that in the last quarter of this year, there would be significant ramp up in supplies of COVID-19 vaccines to countries. So it is possible that lower income countries have to undertake COVID-19 vaccination at a scale which is unprecedented. And I think it is important for PMNCH and all partners to make sure that countries are reminded and are supported in making sure that COVID-19 vaccination and other essential services are seen as mutually reinforcing, and are actually taken forward in a complementary manner rather than focusing on just COVID-19 vaccination and doing it, to the exclusion of other services where we've seen the collateral damage is extremely, extremely high. And I'm going to just share this data point and then pause that we now have estimates that suggest that if we sustain routine immunization and do not allow it to be disrupted, we save the lives of at least 84 children at the risk of one COVID-related death. So it is, and if we look at other essential interventions, I'm sure we have equally compelling data. So just for us to keep in mind that it will be extremely important that COVID-19 vaccination is done at the country level in a manner that also pays equal amount of attention to other services and actually focuses a lot on the most marginalized vulnerable populations. Over.
Thank you, Anuradha. Now, I'm going to be calling Abubakar, then Anshu Banerjee of WHO, UNFPA, Annika, Jean of FIGO, and Gamal from academic research, etc., constituency. So if we can keep it to the 1 to 2 minutes each, we'll get through everybody. So Abubakar, please come in.
Thank you very much, Helen, for giving me the floor. And many of my thoughts has been already shared by Anuradha. I would like really to focus on the zero-dose children and zero-dose community, but linking it to primary healthcare and linking to what Franca has very eloquently said about human resources for health. I think the zero-dose community for us is, as Anuradha said, a trace indicator for inequities. In most of those communities, you have deprivations or multiple deprivations, which needs to be addressed. And if you're not fixing that, I don't think that we will be making any progress in terms of PMNCH. Now, in order to do that, and I think one of the things which the COVID-19 pandemic has basically highlighted, and Darren has basically said it already, is that the investment in health needs to be strengthened and needs to be increased. And the biggest investment and the biggest priority for UNICEF is actually linking it to the human resource for health. If the warm bodies are not there to actually implement, nothing will be happening. No innovations, no medicines, no vaccines will be basically being effective if the human resource for health are not basically addressed. And we're not looking here in terms of doctors. I think Franca said it very eloquently. We need nurses, we need midwives, and I would like to add, we need community health workers, because the community health community is the trust building part between the service provider and the community in itself, because there needs to be trust between service providers and community as well to really encourage the uptake of those essential services. I think these are the two elements which are really fundamental for moving forward, not just to achieve universal health coverage, but also to achieve all our PMNCH goals. And in fact, this will be the only way to strengthen primary healthcare services in order to build back better for the future. And my last comment, Helen, if you allow me, is that we also would like to advocate, and call on partners to support an improved monitoring on maternal mortality. Yes, it's a little bit strange coming from UNICEF, but we do want to believe that the maternal mortality rate is one of the best indicators of measuring health system strengthening in a certain way. If maternal mortality is good, it means that it is also good for children. And I think all our PMNCH indicators will be basically affected in that. And it's in line with the United Secretary General Global Advocates agenda, which includes maternal mortality as one of the 3 priorities in addition to birth registration and nutrition. Thank you, and back to you, Helen.
Thank you, Abubakar. Let me come to Anne Xu from WHO.
Thank you very much, Helen. And a few quick points to complement the others. First of all, from our lessons learned at country level, what we have seen is that for mitigation of the impact on service delivery for essential health services for women and children, it's been very important that programs have been part of the incident management systems at country level to discuss how to best respond to the pandemic. So it should not only be, let's say, an incident management team at country level that looks at the direct impact, but they should integrate maternal child health programs, TB, HIV programs, etc., so that those services are also reviewed as part of the COVID pandemic response. Secondly, I just wanted to highlight the issue of vaccine equity and really support Anuradha's point that if we cannot vaccinate the world for COVID, we will not be able to avoid the indirect impact on services on women and children. So the vaccine inequity issue for COVID vaccines, I think, is a major issue to look at because its indirect impact is on women and children. And we have done modeling, and we can show that for every COVID death, we would have 11 to 80 children saved, depending on the country status and on coverage of routine services in those countries. But the trades-off are tremendous. My third point would just be on the Global Adolescent Summit for 2023. I'm a co-chair of both the reference and the steering group for that, and I just wanted to highlight that hopefully this will pass through the General Assembly later in the year, and countries will call on officially to have a Global Adolescent Summit in 2023, and PMNCH with partners is really trying to take that work forward. When it comes to scaling up cost-effective interventions at country level, the Strategic and Technical Advisory Group of Experts for Maternal, Newborn, Child and Adolescent Health and Nutrition to the Director General at WHO, sorry for that long acronym, recommended really that KMC, an immediate KMC, is really an intervention that can contribute to life-saving or saving of newborn lives. And we're setting up a working group to really see how we can take that forward under the STAGE umbrella, and we call upon partners to join that effort. And finally, I just wanted to highlight, Franco was very generous to talk about health workforce only, but I wanted to highlight the 900,000 midwives that we are missing and that came out of the SOMI report, and how do we strengthen that component particularly. Thank you very much.
Thank you so much, Anshu. Let's call in Annika from UNFPA, followed by Jean from FIGA. If I don't hear Annika, I'll move straight to Jean. Jean, can you come in, please?
Sure, can you hear me?
I can hear you, thank you.
Thank you so very much, Right Honorable Clark. The illustrious members and guests of PMNCH board, thank you for putting together such an impressive panel and really for providing insightful comments that were provided. FIGO stands for Women's Health Across the Lifespan, and no clearer message could have been received today than describing that we refuse a lockdown on human rights. I think that summarized it eloquently. We have 130 national member societies across 5 regions. Our partnership has geographic reach and penetration, and we're able to mobilize a global network to really focus on the health and well-being of women, girls, newborns across the women's lifespan. And I believe that lifespan focus is absolutely critical. We are here to bring together our member societies, focus on vulnerable populations and needs, and our member societies can and do collaborate. We need to bring the focus to well women care. What we need to do is to improve the health and well-being before, during, and after pregnancy with a question for women, first and foremost, is do you wish to conceive? We need to focus on preventive care, like cervical cancer screening and vaccination, like pre-pregnancy and prenatal care, and through access to contraception, safe abortion, and the health of women beyond pregnancy. Our mission is to elevate the status of women and girls. Our core values look at respect, care, and the ability to make decisions for women themselves, and the decisions are made on science. So what will FIGO do? We will provide a bridge between our member societies, facilitating a networking space where member societies can benefit from one another and develop common policies. We can facilitate activities of our member societies, large and small, promote the delivery of evidence-based education around the world. Where societies are unable to join, FIGO will commit to sharing the work. Our pillars are education, research implementation, advocacy, and capacity building. Through education, whether it's webinars, congresses, or toolkits, we can encourage training. With research implementation, we can distribute the results to facilitate that implementation and enable our members to recognize what findings are important and further women's health. Through advocacy, we can work with our regional and national boards, raise awareness about issues, and we've heard clearly today, capacity building with universal health coverage is key. So we will put attention into our network of obstetricians and gynecologists from around the globe looking towards collaboration. We believe that looking forward is the critical role for all of PMNCH through knowledge and education, partnerships in country, governance, and most of all around women's health, our women, newborn, girls, and adolescents carrying that forward. Thank you so very much.
Thank you, Jean. Has Annika been able to unmute now? If so, I give the floor.
I have. Can I quickly make my, it's a half-a-minute intervention. Because my brothers, UN brothers, and so many others have already mentioned what is important. But I would like to say this. I think that looking back to what David said, we need to provide platforms so that young people can hold us accountable to the commitments that have been made so generously in Jeff and in so many other platforms. I think the second one is really we need to find ways to scale. We cannot afford pilots and small programs anymore. And for that, we need to have true partnerships. So the role of PMNCH also is here in aligning us so that we can really go to scale. And we can't afford the territorial thinking anymore. Two more things. I think that we need to move from inequity to inequality if we're going to leave no one behind. I think the human rights-based language is really important, and I think PMNCH can play a role there to bring that forward and connect the data collection on equity and equality and access to vaccines with platforms like the vulnerability platform that UNFPA also has. My last point is that we can strategize together through PMNCH on a strategy for pushing back the pushback. It's now really essential that we do this. And if we can find a strategy to do that, considering the roles and responsibilities that our different mandates provide us with, I think that could be really a very big gain. Thank you.
Thanks so much, Annika, for those very important points. Now coming to the last two who've asked to speak. First, Gamal and then Errol. Gamal, you have the floor.
Lovely. Thank you very much, Your Excellency, Madam Chairperson. I'm delighted to have joined this distinguished panel. My intervention is first concerning the implementation. I think it is important to implement the curriculum of population issues and sexual reproductive health in the curriculum of education, not only for the medical school. And it is possible. We just did this last week. We launched population curriculum implementation at Al-Azhar University in collaboration with UNFPA and the European Union, which is quite possible, and that's for the Muslim world. The other point, actually, which was mentioned also, that's collaboration with faith-based organization. And I think this is important concerning the counter narrative to push back, to counteract the pushback. And we have successful example of the Islamic Advisory Group in collaboration with EMRO for combating resistance for poliomyelitis vaccination in Pakistan, Afghanistan, Somalia, and also utilization of this group for other healthcare issues and other vaccination, and also issuing a statement concerning the COVID-19 and the prevention, social distancing, and all this. And we have seen this recently in the opening remarks of His Excellency the Holy Pope Francisco and His Excellency the Grand Imam of Al-Azhar in the recent meeting of the United Nations on ecology and preservation of environment. And I think their speeches, the counter argument was extremely impressive concerning the pushback which we have been seeing in this issue. The other issue also, and that is the working very closely with politicians and policymakers. And we did this in Egypt, where we could manage to implement laws for child marriage, for female genital mutilation, and the most recently criminalization of medicalization of female genital mutilation. Having said so, registration and accountability are extremely important for this, and we should also learn from the COVID-19 with the use of the e-health service, and also with the use of midwives, nurses, pharmaceutical, and paramedical for delivery of essential service in sex and reproductive health. I think we have a lot to say, we have a lot to do, and we have to collaborate very closely also with the private sector, as was mentioned earlier on. I mean, had it not been for the private sector, we would not have been able to have the vaccines. But also, once we have the vaccine, then we have to make sure of the fair distribution of the vaccine and accessibility to this vaccine in order to be able to overcome this and other pandemics, which I hope they will not come again, other pandemics. Thank you very much, Madam Chairperson.
And Errol, your 1.5 minutes starts now from Healthcare Professionals Associations.
Thank you very much. I'm going to just, the comments made by both Jeannie and Franca represents well, I think, our group. I would remind everybody that we represent the feet on the ground, so we stand available to both inform the PMNCH and also to receive what else needs to be done. From the International Pediatric Association, I would just bring a couple of comments. Some of those have been mentioned already, but we are way behind in routine immunizations, and to get away from the COVID and then find out measles and chickenpox and the others are again devastating the lives of our children. The other issue, I hope we not forgot, so many of our children are now displaced because of natural disasters and wars. Education is falling far behind with the COVID, so much work needs to be done, and your HCPA stands ready to help and support and do the work on the ground. Thank you so much.
Thank you very much, Errol, and for reminding us of those important points about immunisation and the impact of displacement. I just want to give a minute or two to each of our standing committee chairs to react to the feedback which the board members have been offering. We've had very detailed and very constructive feedback. So first, let me call in Joy Pumafi, well known to us all, Executive Secretary also of the African Leaders Malaria Alliance, who's co-chair of our Partner Engagement in Countries Committee. Joy, are you there, and can you come in?
I am here, and I thank you so much. I believe that this has been a really great virtual discussion. Great to hear the passion, enthusiasm, and readiness for action. First of all, I'm pleased to be chairing the PEC along with Vandana Gurnami from the Government of India. We would like to first state that we will continue to work to enhance coordinated, non-duplicative, current partner engagement, identifying synergies and supporting multi-pronged advocacy efforts, engaging partners and constituencies from the grassroots to the highest political level. and would also work with the regional mechanisms, all of which are represented here, international mechanisms, national mechanisms that are working on women, children, and adolescent health. So, that I wanted to start with that statement, and that, all of you are urging not for a change in focus, but for sharpening the advocacy tools that we currently have for greater impact. What I'm taking away is that the key consensus is that the COVID-19 pandemic has intensified existing access and inequity gaps in primary health, in social and economic systems, increasing marginalized vulnerable populations and magnifying the negative impacts. His Excellency President Ramaphosa at the G7 called for addressing the substantial financing gaps for tests, treatments, critical supplies like oxygen, health systems, that will enable testing, treatment, but most importantly, like people have said, vaccination. So the call to PMNCH is for us to ramp up advocacy for the right actions
Draft decisions and guidance, you'll see there. So basically that first page just says what we sought to gain guidance from the board members on, and then come to the takeaways from it, please, Nebojsa. Strategic shifts in advocacy. So what has been noted from the meeting is definitely this focus on vulnerable populations, the vaccine equity issues, which are big, pushing back on the pushback and relating that to call for action 2, investing in our health workers, investing in adolescents, and harnessing the power of digital technology, all very important points. And then I think you have one more slide there as well around our board champions. So we had the commitments of Mia Motley and Kirsty Calgulade, UK government's work, obviously with the high profile for health at G7, Government of India committed, Government of Liberia recommitted, Government of France reiterated their additional funding around gender equality and SHR, and the Government of Belgium also there. Can you just scroll that up a bit, because I have something blocking the rest of that slide. Yeah, may have World Economic Forum, and I think there's wording in between there that I can't quite see. But we will work on improving those summaries, on mobilizing additional champions and networks, strong call for focusing on the country level partnerships, working with the regional mechanisms, deepening our relationships with parliamentarians and the private sector, and underlining the critical importance of ensuring that the voices of adolescents and youth are heard and help shape the work of PMNCH. So those were the takeaways that our Secretariat has summarised for us, and it could be useful, if you can, Secretariat, to put a link to those slides in the box for people. So we've heard that political engagement and champions are critical to PMNCH's work. Secretariat can now work with the relevant committees on operationalising the effective engagement and support of our champions. I think coming out of this, we need to have a very common understanding of the advocacy roadmap ahead of us, and that our results framework is clear about what successful will look like. The Secretariat will follow up the meeting with the appropriate documents and tools around giving us that common understanding, and of course work on how to use the various champions supported and integrated with the work of our constituencies and grassroots organisations. I understand our next meeting is due to take place around the beginning of December. We have an executive committee meeting chaired by Darren next week, which will be taking forward the recommendations from this board meeting and focusing on how to operationalise them. So thank you everyone for just an incredible range of constructive and well-considered contributions, which are very helpful to all our working mechanisms. Helga, are you trying to say something?
Yes, please. Thank you for that. I would like to suggest that we all put our videos on for the picture, for the usual board picture.
Yes, you can do that.
And I think it's always very polite to alert board members that this is happening instead of us taking a picture. So this would be great. And then somebody in the Secretariat, I hope, Julia or Michael, please, I'm tasking this on to you. So thank you. And you have to tell us when you've taken the picture. So.
Okay, I can count. So I'm gonna count to 3. 1, 2, 3.
Thank you. Over to you, Helen.
Right,
And thank
thanks.
you from my side.
Thanks very much, and thanks to the Secretariat for all the help in preparing the meeting and in supporting Executive Committee next week to take what has come out of the discussions forward. There is an evaluation form, I understand, provided in the chat box. If you could fill it out, that would be appreciated, so that the Secretariat with the Governance and Ethics Committee can look at your comments, and that helps to plan future board meetings so that they meet the expectations of the board. And of course, a short note for the record of the meeting and the recording of the video will be sent to everyone as soon as is humanly possible. So let us say sayonara, a bientôt, hasta la vista, and thank everyone again, and wish you all well, and look forward to seeing you online in December. Thank you very much.
Bye.
Thank you so
Bye,
much,
everyone.
Have a good
Bye-bye.
day.
Thanks, Helen.
Bye.
Thank you. Bye. Thank you.
Thank you, Helen.
Bye.